All right, everyone, welcome back to another episode of Forward Physio. Today, I'm with Jason Tuori. A couple episodes back, I spoke to Jason's co-host of PT Inquest, and today we're almost done the trifecta. Next, we have to get Megan, but today we're blessed to be with Jason. Jason, how's it going?
Awesome, Noah. Thanks again for having me. And yeah, it seems like I just can't get away from Chris or Meg for that matter. But Chris and I are teaching a course now too, and so I see him like at least once a month in person, and then we're on the podcast weekly. So we don't have much time apart from each other.
Well, you're lucky to be alone from him now. You're your own person. He's not here. You're safe here. Do you mind giving everyone a bit of an introduction into just who you are, what you do professionally, and just also what you're interested in, not from a professional perspective?
Oh, sure. So I'm a sports physical therapist based out of Rochester, New York, in the United States. Uh, I currently work in an out of network a private practice role. So we do a bit. The title is performance therapy. It's a clinic called Mana Performance Therapy. We do pretty much a bit of everything: rehab, performance work. We do some sports science work with a junior hockey team and a couple other professional teams in the area. On the running side, we're going to talk about running today. Buried the lead. I am the vice chair of the running special interest group, the American Academy of Sports PT. I've worked with a number of endurance athletes, triathletes, track and field athletes in the past. Kind of just became one of my niches that I settled into. Did some former work in working in pro soccer with an MLS Next Pro team. Uh, and I've been kind of in various like outpatient and hospital based settings too. So kind of seen runners and the endurance athlete across the spectrum from doing the emergency response race coverage side of things through the just performance training. Training runners up to about the marathon distance. I mostly work with middle distance athletes as kind of the where I feel most confident that I can ring out their talent. But yeah, that's from the running side of things. That's a lot of what I've done in the past.
Are you a runner yourself?
Yeah, so that was the first sport where I felt like I was like, oh, we're actually like pretty good at this. Doing sport sampling a lot growing up. I think I was around 16 by the time I was like, all right, yeah, middle distance running is the thing that I'm doing about year round. Continue to play some basketball on the side because now knowing what I know, I was like, oh, that was in hindsight a pretty forward thinking thing that I was doing. As I bet we'll talk about some injuries shortly here. Um,
Yeah, I did want to talk about that. So I'm glad that you brought that up with your sports sampling.
Yeah. So did some sports sampling and kind of settled on like the 800 and mile as the things I was best at. Went on to run up to the marathon distance and then came back down and did some more middle distance things. Realized that it's actually a lot more fun for me to run a 2 to 5 minute long race every couple weeks than to run one race that's several hours long every 6 months. So to each their own for sure. But yeah, that's about where I settled out. And then now I kind of I train for health and for the enjoyment of the sport. I would say I'm functionally retired from competing, but yeah.
Yeah, got and I've seen Mana as well where you work. That place looks awesome. Like there's just Tindex everywhere. I
Oh
think
yeah.
yeah, it looks like a very cool place to work. So I'm guessing that you guys just have athletes coming in all the time.
Yeah, I mean it really is one of those like dream settings from a sports rehab standpoint. Everyone you work with is an athlete ranging from recreational athlete with performance goals to professional athletes. It's all one on one. And so yeah, we're very blessed to be in that setting. And we've got some cool toys. We definitely,
Yeah.
we've got the Tindex, we've got some force plates, we got a couple other things coming. We got a couple of the flywheel systems type things. So yeah, really as many toys and space as you would need
Yeah.
to have some fun.
Yeah, it's awesome. And Chris, if you guys don't really know what we're talking about, that's what the whole episode with Chris was all about. Just sort of force plates, force measurements, Tindex, all that sort of stuff.
Yeah.
Anyway, That's not what we're here for
I
today.
bet
We're
I bet we might get into that a little bit today. It's hard to get away from it, but
probably,
we
probably.
won't have to do a whole episode on
Yeah. If you guys do need an intro, you know where to go, just
it.
reference that. But if you're all up to speed on that, then yeah, we'll get into it, I'm sure. So running related injuries. It's I think an area where there's so much confusion and varying opinions and misinformation. So let's try and solve all of the world's problems when it comes to that confusion today. All right, Jason?
Perfect. Yeah, can do.
Cool. So what are the most common running related injuries? And does it differ, depending on if you're a middle distance runner or long distance?
Yeah. So kind of to start off, like you would, if you're thinking like running related injury is a pretty broad category, you would be right. And so you would want to know like what's the actual definition of a running related injury, because is an ankle sprain that you sustain by accidentally falling off the sidewalk a running related injury? Technically, yes, you got the ankle sprain while you were running. I think the majority of what we think of when it comes to running related injuries are these non-traumatic, quote unquote, overuse type injuries. There was a consensus statement that was adopted in 2015 that some research papers use to keep it consistent from a reporting standpoint. It's the one that you see where it's like, if something alters your training for 3 consecutive sessions or 7 days. The problem with that is that not everyone uses that. So they made this consensus statement and not everyone decided to follow it. So um, it is what it is on that
Perfect.
side of things. Yeah, great. So reporting is still an issue on that. Largely, what you see out of the running epidemiology literature is there's a review about every 2 to 5 years. A lot of them pull from the same papers from the 90s on. And so from about 2002 to 2022 maybe was the most recent one. You pretty much are kind of recycling the same original research and pulling from injury epidemiology out of those. It still kind of seems like patellofemoral pain is one of the most common running related injuries. We do see that slightly more in females than males. And there is a bit of a breakdown. You could probably say, like, from males and females, the top 5 most common running related injuries might be a little bit different. But on the whole, if you were, you're a rehab clinician, you're working with runners, somebody walks in the door and you don't know anything about them, your probability says it's a good chance that patellofemoral pain, Achilles tendinopathy, some kind of bone stress injury, and now that in itself is multiple different injuries, right? So we're just talking about the tissue that's involved, but your tibial bone stress injuries, metatarsal bone stress injuries specifically being the most common. But when we see bone stress injuries, we also know that somebody is more likely to incur one if they've had one in the past. And that doesn't really seem to be site specific. So you do see that like bone stress injuries are kind of this whole category of running related injuries that are relatively common. So on the whole, it's probably these like lower limb tendons, lower limb bones, and then kind of these hot spots like patellofemoral pain, iliotibial band syndrome, plantar heel pain, if you consider that to be one of those hot spots versus more of a tendinopathy type injury. Those would probably be the most common on the whole. Yeah.
So outside of the Achilles tendinopathy, are there any other common tendinopathies that a runner would get? Like what about patella tendinopathy or, like a tib post or some other, like
Yeah.
lower limb tendon?
Yeah. So you do see some of those positional tendinopathies like a tib post or peroneal tendinopathy. Um, True patellar tendinopathy is actually a bit more rare when it comes to runners. This is probably more in multi-sport athletes who may also run. So the individual plays basketball, the individual plays soccer, some of these more like deceleration focused sports, that tendon can then go on to get aggravated with running.
Mm.
But it's actually quite rare for it to true patellar tendinopathy to be just in a long distance runner. We do see proximal hamstring tendinopathies, and that's largely a little bit more in the master's age population, a little bit more female compared to male. And that would also be consistent with gluteal tendinopathy too. So we see that a little bit more in female runners, usually usually higher in age, not necessarily. Those are pretty much the most common tendinopathies. And then again, if you consider like a plantar fasciopathy, a tendinopathy, um, we would see that, but we're kind of weary about just calling everything that's hurts underneath the heel plantar fasciopathy.
Yeah.
It's kind of get into the same issues as that and patellar tendinopathy and everything that hurts in the front of the knee. So there are other things
Patellofemoral
that,
pain.
yes, which would be the most common running related injury. Exactly.
Yeah.
Um,
Oh, the knee
yeah,
hurts?
yeah, exactly.
Right. Okay, cool.
Yeah,
So you mentioned some risk factors there, right? Like, so it could be sex, it could be age for certain injuries. Like maybe women are more likely to get the patellofemoral pain or the proximal hamstring, and the gluteal tendinopathy if you're a woman and you're of older age. You mentioned bone stress injuries and how
yeah,
those are a very strong risk factor for future bone stress injuries. And
yeah.
I'm wondering, like if that's because number one, maybe that's indicative of training habits. Number two, maybe that's just indicative of just global health, right? Because your overall health really affects bone health. And then if you have very low bone density, that could potentially be a risk factor. Um, if you want to expand on any of that, go for it. But I'm having a thought, like, do we think that that whole body ecosystem sort of health is a risk factor for other running related injuries as well, outside of just bones?
Yeah, I mean, I can definitely comment on the bone thing first, and maybe even more generally than that. The idea of subsequent injury classification is challenging because, right, we know just from research that both from a bone stress injury and from a general running related injury, a previous history of injury is the most significant risk factor for developing a future injury. That's the strongest risk factor across the board. You can make the case then, let's use bone stress injuries. Well, you can say, okay, well, the reason that they got injured a second time was because number one, maybe they didn't fully rehab the first one. So incomplete rehab could be a reason for that. Number two, their training habits did not change. They didn't learn their lesson. Okay, they didn't learn their lesson.
Hmm.
Three, something systemic like low energy availability or low bone density, or any or all of the above is still going on. And therefore, even if they did change their training habits and they fully rehabbed the previous injury, they were still vulnerable enough to develop this other one. And fourth is just like genetics, and we don't really know this for some reason. There's some individuals are more susceptible to certain injuries than others. You see a plantar fascia rupture, and you're just like, how did this happen? And
Mm.
uh, you know, plenty of people go through their entire lives without rupturing a plantar fascia, but for that individual at that time point, it was the weakest link in the chain for some reason. And I have to think that there is just kind of this like underlying genetic component to it that we still also don't understand yet. And so, we're looking
Mm.
at a lot of these risk factors that we do have on paper, but it's kind of like the graph of the like what you know and then what you don't know and then what you don't know you don't know, and you're just
Right.
like continuously zooming out in circles. There's a lot of the what you don't know uh, going on around here. um,
Hmm.
but yeah, I do think that that's probably consistent with general running injuries too, right? So some kind of just low, whether it's low energy availability, whether it's high stress, whether it's just an environment that is not conducive for good tissue recovery, and then you're participating in a sport that is predicated on doing the as much volume as possible with as little rest as possible in between those sessions. It's pretty reasonable, I think, why running has one of the highest injury rates of all sports.
Mm.
It's like
Why?
there aren't really many other sports where it's like, oh, it's very reasonable that you just keep doing this thing over and over and on very little rest. Um,
Mm.
but we accept that as part of the training.
Right. Interesting. Yeah. I mean, like, so I think it's very interesting how you spoke about how, you don't know what you don't know, and that there's so many risk factors out there that are probably just not known or a bit murky right now, whether they are a strong risk factor or not. But I find a lot of the way that people talk about these risk factors is that it is all known and it's all about biomechanics, right?
Yes.
It seems like there's so much certainty when it comes to that about, like if you run this way, it's going to cause this injury, and all that you need to do to fix it is to address the biomechanics. So are they a strong risk factor for running related injuries as it pertains to, again, like let's say these overuse ones? Are they ever
It's yeah,
important?
it is a great question. It always comes up, and it's funny that when I was learning about all these things, PT school, and even just doing my own reading before I became a PT because I was a runner, so I had injuries. It never really sat well with me, the idea that like running form is one of the strongest causal factors, because my logical brain is like, but what if you only ran 3 steps? Like you ran 3 steps in this wonky kind of way, like that's probably not enough to make you get injured. And
Right.
so I immediately started thinking about this dose response effect, right? And so that to me is what biomechanics are, is a moderator probably of load. Um, to circle back to your first question, the literature pretty much points towards, if we are examining running related injuries as a whole, there are no biomechanical risk factors that are consistent with all running related injuries. So
Mhm.
in other words, there's no biomechanical factor where you would see that and say that is going to make you at risk for developing a general running related injury. Now, one of the reasons for that is because it's hard to study all injuries as one homogeneous unit. And that's one of the
Yeah.
biggest issues that the running literature has, is that through current day, we treat all running related injuries as the same thing. The outcome is you get injured. The input is you ran like this, your training looked like this, your muscle strength was this, that, or the other. That also doesn't really make sense, because there's no real plausibility that the same risk factors that would create an onset of Achilles tendinopathy are the same risk factors of sacral bone stress injury. Like
Yeah.
that just, yeah, that doesn't seem very plausible to me. So then you say, well, then in order to understand this, we need to have very high sample sizes of these specific injuries, so then we can actually analyze risk factors, because you underpower a study if you're looking at, well, what are all of the potential risk factors for all potential running related injuries? You'd have like,
Yeah.
you'd run 40 variables and then you'd look at like 180 different outputs, and it would be woefully underpowered.
It sounds
So
like my research project when I was still in physio school before I understood that.
yeah, send it over. I'll give you a few pointers.
There's not a shot I'm ever sending that out there. I think it got published. I don't know how.
Oh boy. Well, there you go. There you have it.
Yeah.
Um, yeah. So you would need it. To me, it's not that biomechanics are irrelevant. There may be certain biomechanical factors that could put somebody more at risk for something. We see, University of Wisconsin had some recent research on running step rate in the development of bone stress injuries. Now, again, that was even pretty large too, because they were considering all lower limb bone stress injuries. And what we now know about those bone stress injuries, or think that we're going towards, is that things that are more proximal in nature are probably more related to energy availability. Things that are more distal aren't necessarily not related to energy availability, but may have more of a local ground reaction force biomechanical impact to them.
That's
But
interesting.
yeah. So that's some of the most recent work that they're putting out, is kind of differentiating proximal to distal bone stress injuries. But that
Mm.
study was in collegiate runners, and it was those who were on the lower cutoff were more likely to sustain a bone stress injury over the course of however many collegiate seasons. Um, and then there was I think a single prospective study on patellofemoral pain in female runners, recreational runners, and larger hip adduction angle. So more of like a valgus position, being a prospective risk factor. And other than that, I don't know that we have enough to say if somebody walks in the door and they're completely healthy, and that we should look at their biomechanics and tell them that there's something there that's going to lead to injury. I don't think we can say that.
Yeah, because maybe they have that hip angle, but maybe they never go on to develop patellofemoral pain in the first place. Like, what
Right.
do you focus on? Do you just focus on the probability, and because that's the most common injury, then you just dial it on patellofemoral pain, but then maybe unknowingly tell them to do something that could potentially increase their injury elsewhere. So
Well,
I, I
that's a great point right there, because I think we do that a lot as
mm,
clinicians. Is we're so focused on reducing force at X location, and all we're doing is just shifting it somewhere else. That is what changing someone's foot strike pattern is. This
yeah.
idea that, like, well, if you're rear foot striking, there's more load on the patellofemoral joint, so you should forefoot strike instead. And it may reduce the load at the patellofemoral joint by way of increasing their step rate and shortening their step length. You just added a lot more load to their Achilles, which
Mm,
is not a bulletproof area for runners. So
right. Right. Yeah, again, as you said, Achilles tendinopathies being one of the most common injuries. So
right.
is what you were saying earlier about how if we look at a certain biomechanic, whether it's like ground reaction force or whether it's the actual like sort of like the kinematics, how someone's moving or their foot strike pattern, whatever it may be, we can't say that any one thing on a whole will cause running related injuries. And a big issue with that is just because there are so many different ones and we can't study them all at the same time. But maybe if we're looking at one variable and one body part, we could maybe start to sort of tease out whether or not it is a risk factor or not. So like maybe
Yeah,
heel
and
striking is not relevant for some sort of hip related issue, but can you say that it's a risk factor for anything?
with the current evidence that we have, we can't. I think the idea comes from just the basic biomechanics of certain load on certain structures, right? And
Hmm.
then also our idea that certain structures have a lower ceiling of adaptability compared to others. And I think that certainly has merit. There's a lower ceiling of adaptability of our sesamoid bone than our patellofemoral joint, the bigger sesamoid, right? Just by way of cross sectional area.
Right.
So you're kind of banking at that point on, well, can we balance the system a little bit more? And if somebody has had multiple injuries to a certain area, is it a fair suggestion then that they increase their step rate so that it decreases some stress on that area? I think that's where it gets into managing someone's history in the context of their current running situation rather than just a completely healthy runner. I
Hmm.
struggle with the idea of changing something with a completely healthy runner, because one, it's so rare that we see completely healthy runners, so I'd never really have to have this dialogue. Uh, and two, I don't like creating problems when they don't exist. So I feel pretty good then about just saying follow a good training plan, get a good coach, and you know, if you run long enough, then you might get something that pops up, and then you deal with it from there. But
Right.
yeah, this idea that we can prevent things is it's very far away.
Hmm. And when things aren't prevented, when someone does get an injury, you're okay sort of changing how they run?
I would say the only one that I really play around with at this point is running step rate, running cadence,
Mm,
and there are a couple of reasons for that. One is that all it seems to do is just reduce the total load per stride, right? So per each stance phase, because you're increasing somebody's step rate at the same given speed, it's decreasing the total vertical ground reaction force. It's reducing some stress at the knee, at the hip, and to some extent the ankle. Um, it seems to be pretty easy for most people to do, especially with wearable technology beeping at them when they're doing it wrong. That's my preferred way to have them do that. I know we're all taught how to do this on a treadmill, but it's like, realistically, how many of our runners are on treadmills all the time?
right.
So I like to use a wearable device like a Garmin that beeps at you if you're outside of the target running cadence range. We do a very small increase of it. I usually bump it up 5% above what their preferred running step rate is. And if they
Mm,
get some kind of symptom relief with doing that, then I'm pretty happy to just have them practice that throughout the course of their training,
cool.
recognizing that it probably only really works at their easy run speed. because once we get into race paces, our step rate is naturally going to increase anyway, as is our speed. And it's really hard to like, if you've ever played around with changing your step rate with running, you do it at easy pace and it's pretty reasonably easy. Sometimes people speed up a little bit because that makes sense to them. But if you're running at like your 5K race pace and then you try to increase your cadence, there's not really that much more to go, right?
Mm,
You're already booking along pretty quick from a stride rate standpoint, and let alone any faster than that, getting into like mile race pace and 800, which is a few notches below sprinting. So
right.
yeah, pretty much it seems to work with easy running the best. I don't really mess around with foot strike stuff anymore. I used to
Like
be a
the
little,
like how they're striking with their foot,
yeah, like
not the
switching from a
cadence.
rear
Yeah.
foot to a, yeah, right, exactly, switching from a rear foot to a forefoot intentionally. um I used to do that with patellofemoral pain, and I didn't really see much of a difference between that and doing the step rate increase. And the benefit of the step rate is that it doesn't seem to increase the loading at the Achilles tendon the way that the forefoot running does.
Mm,
um yeah, other than that, I mean, I also have a pretty I'm pretty skeptical that what we train somebody to do in a closed environment is actually what's happening as soon as they're outside of our walls. So
yeah, yeah, yeah.
this is a big thing for me where I'm like, all right, well, I just spent X number of minutes showing somebody how to run differently. Is this actually what's going to happen as soon as they go out onto a trail, to a, even if they're on the road, like, they're out in an open environment, they're not thinking about it. Yes, we have some of these wearable devices now that can track your step rate and track some other running kinematic variables, but um I don't know, changing someone's movement is really hard. I mean, it involves a lot of repetition and enough constraints and affordances for them to kind of be guided into a new way of moving that is less efficient for them, because
Mm,
the way that we run is the self-selected most efficient way for us at this time. I understand the arguments of, well, but if you trained this long enough, then it would become even more efficient. The potential is higher, but the short term is worse. It's pretty hard to
right.
argue that. I mean, a little bit of like a running cadence change, yeah, up and down by 5% doesn't seem to change running economy or the cost of running very much. But as soon as you exceed 10%, it starts to decrease, and worsening economy is not a good thing for
Right.
anyone who's ever driven a car. Um, yeah, so that's pretty much what I do at this point from a running form side of things. Largely again because I don't know how much of it is actually something we can change, at least in a relatively short period of time.
Yeah, and I think if they have that audio cue with the Garmin beeping at them, like that seems like a reasonable change. But they don't think about it for 5 minutes. Next thing they know, they're heel striking again. Or so I'm with you
Yeah,
on that.
they're kind of
I tend
right.
not to try and change that too much. I do want to get into shoes, and I feel like it is sort of like a natural segue here. But before that, I just want to sort of comment on the fact that people have injuries, and you're still getting them to run, right? So when it comes to these running related injuries, are there any that you'll say, hey, like we need to stop running
Oh yeah,
completely? And like I'm thinking bone stress injuries.
yeah,
Are
exactly
are
that.
are there any others?
Well, yeah. So the hard stop is like bone stress injuries, specifically those at a high risk site. So things like femoral neck, certain parts of the, certain metatarsal areas, fifth base of the fifth metatarsal, things like that. Um, yeah, I think from the other side of things, like, I mean, I've recently had a case where it was a little bit more of like a metabolic, kind of like an overtraining syndrome type thing,
Mm,
where this individual just kept hitting a wall. And it was like oh, this is pretty real overtraining type stuff. So whether it was a combination of energy availability, other just kind of other metabolic factors, it was like, hey, why don't we take a little bit of time off on this and go get some lab tests? Like, let's just make sure that we're doing all right, and then let's
yeah.
let's pick this back up after that. Um, Yeah, I feel pretty good about recommending a stop on that. The other I kind of think of sometimes would be like a exertional compartment syndrome. Sometimes when it gets so flared up, you're like, listen, brother, it's stop for a little bit, or we might be heading for the fasciotomy. So
Yeah,
let's
yeah.
let's like just let that thing settle down for a bit, and then we're gonna gradually work our way back up and see how it's feeling from there. Um, those would be the most immediate things I can think of outside of your, other like cardiac related things and stuff that I might not be the right person to come to for.
Right. Yeah, yeah. Yeah, I would love to get into the treatment for all of these different things. Like, how do you then go about like assessing and diagnosing a bone stress injury or exertional compartment syndrome? But I think that's beyond the scope of it. But I think it is just good for people to know that diagnosis does matter a lot of the time with
Oh
these
yeah,
running related
yeah.
injuries because they can dictate whether or not that person should stop running. So you can't miss.
Absolutely. Yeah, and I think that's the uh, anytime you have a runner, you just have to be thinking about a bone stress injury, even if you're a little more on the cautious side. If something about it just doesn't seem quite right, like know your high risk sites, and if it just doesn't seem quite right, get them an MRI. Like it's not worth them running through this thing just because they thought it was shin splints or some other
Mm,
non-serious thing.
yeah, for sure. So let's say we have ruled out those serious things where the person should likely stop running. At that point, how much does the diagnosis matter? Like whether someone's dealing with an Achilles tendinopathy or patellofemoral pain, obviously very different areas of the body,
Sure,
right?
yeah,
But like are there common threads between all these other repetitive, again, like if we want to say overuse injuries that
sure.
you can keep running with?
Yeah, to me, I guess that is a good question. The how much does it matter? Probably the framework of the treatment is probably pretty similar. The specifics of it might just be guided a little bit more towards the local area. And so, an
Hmm.
example of that could be your Achilles tendinopathy and your patellofemoral pain. You could put someone who's at a similar level of symptom irritability on the same return to run, walk, run interval progression, and they might actually do pretty similar. Their rehab plan might look a little bit like really emphasizing calf raises as your key exercise for the Achilles tendinopathy and some kind of, if they're in the right stage for loading the patellofemoral joint, some kind of knee dominant exercise to improve patellofemoral joint capacity. um, but the Achilles tendinopathy individual is probably also going to be doing some sort of knee dominant thing too, because the quads matter for running. And the patellofemoral pain runner is probably going to be doing some calf work because the calf matters. So, yeah, I think when you see my running programs, it's like make sure we are prioritizing the actual site. So, one key exercise to improve capacity of whether it's tendon, whether it's bone, whether it's uh, whatever we think causes patellofemoral pain, subchondral bone, plica, whatever. Uh, and then the rest of it is just like squat, hinge, calf raise, because those are the primary things that a good running performance strength training program would look like anyway. So I pretty much build everyone's program out like, do you have a strength coach? If not, then I'll just do this. If you do, then I will take on the rehab side of things and I'll give them very clear instructions on like what's in the sandbox as far as their strength training, like what they can and should do at that point. And it's kind of same goes with the running coach itself. I think it's important for us to remember as on the rehab side, like things could range from, you work with a recreational athlete or a younger athlete who doesn't have this other support staff of coaches and other doctors and things like that. And then you can be on the other end of the spectrum of working with the higher level athlete where you don't need to be their coach. You don't need to be their strength coach. You don't need to be their sports psychologist. You need to be their rehab provider, physiotherapist. Like, do that thing really well because that's what they came to you entrusting you to do. Um, And those are actually relatively straightforward cases. From the rehab side of things, you just need to be a good communicator and let everyone know what's happening, and not try to be more than you need to be in that case.
Mm,
Whereas some of the other, private side clients, maybe recreational client who doesn't have that other network, is, well, how much do you want slash need me to be for you? Because we can write the training plan, we can write the whole strength plan. Do you need this from me right now, or do you just need to rehab and be on your way? That's
mm,
that's kind of how I operate for the most part. I'm big on, like, just whatever you need me to be. That's the hat that I can be, but I try not to overextend myself and do more than I need to. Not out of
right.
laziness, just out of stepping on people's toes.
Yeah, fair enough. Fair enough. So just to sort of recap there, like the common thread between those injuries would be maybe back off a little bit and then slowly increase the running, build the capacity at the injured site, and then also do a little bit of everything else. The
Yeah,
hinge, the squat, the calf
a
raise.
little everything else. It's Yeah, I think you can say it from it's finding an entry point from a running standpoint is
Yeah.
probably the trickiest part. And that's where I think a lot of people are really intimidated by this idea of, like, creating a return to run program. And it's like, we're all basically just doing this as an educated guess. The first time they go out and do that walk run plan, and you give them very clear, if this happens, then you do this. And if that happens, then you do that. And you have a hard cap on the day, even if you're feeling good, that is when you're going to stop. And then you're going to see how it feels during, afterwards, and 24 hours later. And if it satisfies all those conditions, then we either will decide to do this exact same thing again, depending on how conservative we want to play it, or we'll progress it a little bit. And that's the secret sauce. There is no, everybody's got to start at 1 minute on, 2 minutes off. Like, it's
Right.
pretty much just finding what is the entry point where they can consistently go back to, because it's not starting above their capacity.
Hmm. Makes sense. Do you have, I know this is tough to say, and this goes into the word or what this is called is escaping me right now, but do you have sort of a percentage at which you sort of increase people's running from week to
Oh
week?
yeah, yeah. I
You
think you're,
don't,
you're thinking of a heuristic, like
no,
the
no.
mental model.
No, it's this model for making sure that people aren't like just doing too much too quickly when it comes to loading it up. It's like where you don't
Gotcha.
increase
Yeah,
by
yeah.
more than 10%. I forget what it's called, but it's a whole
Well,
load
there
management
is
thing.
there is the 10% rule, but I
Yeah.
don't use that now.
What do you
um,
use any rules?
there are no rules where I work. Yeah, no. I would say I most often I use this, like, well, what is our target date for when we need to be somewhere? Like,
Mm,
okay, in 6 months you have a marathon, which means 6 months minus 3 weeks is when I would want you to do your longest long run. And let's do some back of the envelope, but not really back of the envelope, because Excel is always open on my computer, math to work week to week back from that point. And then I kind of use the first 2 weeks as just like a black hole with a question mark on it, and say, well, all right, it seems reasonable that if we can find an entry point here, we do this thing every other day. Eventually, we're working up to 3 30-minute, in a case if somebody's not running completely.
yeah.
Maybe we work up to 3 30-minute runs before we decide to add a back to back in. And 30 minutes is an arbitrary number. I'm going to get right out in front of that one already. But people use the 30-minute run as an easy session. It's a common duration for an easy session. You could say 5K. You could do, here's your easy 5K.
Right.
And then we pretty much just continue to layer in frequency a little bit after that. And I'll have somebody go for a couple of weeks, keeping the same frequency, number of days per week, before adding another day per week. Um, yeah, I really don't. I used to play around with, like, we got to get to this percentage and that, and it was a little too rigid for me. Now I like to just kind of play around with, like, well, where do you need to be and when, and if we
Hmm.
reverse engineer that back and just try to create the slope as gradual as possible, recognizing that it's probably a little bit more of like an exponential curve at the start, and then it's a little bit more of a linear slope after that.
Just because they're recovering from injury, and that's sort of how that usually goes.
Yeah, you're going to want to take
Yeah.
it a little more gradual. And then once you get more and more data points that shows you, oh, they can handle it, nothing bad happened, then you have a little bit more risk tolerance as you go. Um, that and there's only so much you can percent increase if somebody's starting at 1 minute.
Right.
So
Yeah.
it's just like just insanely long if you were rigid with 10%, 20%, whatever. There was some research on this too. It was the Run Safe group out of Denmark. They kind of cut up I think they had two or three different treatment groups, and one group increased their volume by a certain amount, and one group increased their intensity by a certain amount. And it was like basically debunking the 10% rule. There wasn't much of a difference in injury risk until it got to like the 30% barrier.
Right.
Which is like, yeah, that's pretty sizable an increase.
Gotcha. Okay, cool. I think that provides probably a helpful framework for people to understand how to gradually build people back up. And I promised everyone that we would circle back to shoes. So
Oh
I
yeah,
think
yeah.
we spoke about biomechanics, and to me, shoes is like it's a similar sort of conversation. Would you agree with that?
It is. I also put this in the category of like things that moderate load. Like biomechanics is a moderator of load because the way that someone runs, which might shift stress more to one area versus another, times their training load would just change the total amount of stress in a certain location. That's pretty much what footwear is. It's a if you have a little bit more of a stack underneath your foot, then there is less direct loading on the metatarsals. You've got a little bit less, and vice versa. The weight of the shoe matters. So a heavier shoe versus a lighter shoe, largely it's mostly from a running economy or efficiency standpoint. So every 100 grams that you remove from a shoe improves running economy by about 1% until you get to a certain limit of like barefoot is actually not more efficient than some amount of shoe, despite what some people would want to believe.
Yeah.
Yeah, it's too bad. I mean, this whole high performance footwear thing really throwing a wrench in the Born to Run crowd. But
Right, exactly.
yeah.
That's hilarious.
Yeah.
They don't care though.
No. I mean, they didn't have Pebax foam and carbon fiber plates back in the day.
Right.
Yeah, it's the idea. I think a lot of people associate footwear with like, oh, the anti-pronation model. Like you have to use a shoe to reduce the amount of either dynamic pronation or combination ankle eversion, forefoot abduction, dorsiflexion. Or someone's just static foot structure. If you've got a flatter foot, then you need more of this medial lift. None of that has really panned out from an injury risk standpoint. So there doesn't seem to be. There's pretty large scale military study on this in about 2014, I think, and they basically just matched up the classic running shoe store model of if you've got a really flat foot, you get into the motion control shoes, and if you're like kind of middle of the road arbitrarily, you're in a stability shoe, and if you've got a high arch, then you're in a neutral shoe. And there was no difference in injury rates amongst any of the groups compared to just randomly assigning a shoe. So with all of that said, what I usually recommend people do when they ask, what should I run in, is, well, number one, do you like what you're running in right now? And if so,
Jason, sorry, is this for people without an injury?
This would, yeah. So let's say this is a runner without an injury.
Okay.
Do you like what you're running in right now? Okay. If yes, that's easy. Just keep doing that. If no, go to a running shoe store and pick out 3, 4, 5 other pairs of shoes that are not too dissimilar to what you're currently wearing, because this gets into if you're going to change models of shoes, if you change from something that's a like loading profile to a like light loading profile, there's probably not a huge difference other than just like little hotspot, like blister pattern type stuff.
Yeah.
If you're doing a drastic change from like a maximalist shoe to a minimalist shoe, that is changing load. That is a moderator of stress.
Mm,
So we're shifting more stress to the foot and ankle by decreasing the overall amount of just general stuff around it. Um, that in combination with the transitioning into a lighter shoe also probably changes the way that someone's moving and makes it more foot ankle dominant.
mm.
Now let's circle to the somebody is injured and is asking about their footwear. I have a lot of questions for them usually about like, well, was this the kind of thing where from a temporal standpoint, you made a change in footwear and immediately you developed a running related injury? And if that's the case, I still suspect that there's some kind of post hoc fallacy going on. Um, but they probably
I
already
love
believe
it.
it. Yeah, they probably already believe that it's the problem. So I'm like, do you still have your other shoes that you switched out of? So just go back to
Yeah, don't
those.
fight them on it, right?
Yeah, yeah,
Yeah,
yeah.
yeah.
Um, if it's, I mean, if it doesn't, it's like, yeah, I changed shoes 3 months ago and now I'm here. Like, well, I don't know that was like the hottest log then. Like,
Mm,
let's investigate some of the other training related things that you've been doing. And we can almost always probably find a better rationale than just footwear alone.
yeah. Okay, cool. So that example where you wouldn't drastically shift someone's footwear when they don't have an injury, it's sort of similar how when someone comes into the clinic without an injury, you wouldn't say, like I think you should run this way because you're suddenly dramatically shifting how they move or
Yeah.
how much support they have and that may potentially put them at risk for developing an
Well,
injury.
yeah, and this was pretty popular in the early 2000s, switching into more minimalist shoes. And while
Yeah.
that might be a great way for the front of your knee to feel better, you just drastically increase the amount of stress that's going into your foot and ankle. And I have to think that there's some contribution to some metatarsal bone stress that's happening there too. I
Hmm.
always, you see, I'm very, very political about how I say these things. I rarely say something is causal, but yeah, I mean, if you're taking stress away from one area and you're adding it to another, well, you just added a lot of metatarsal bone stress. So use use that for what you will.
Yeah, you're still not saying it's causal. All right, we'll leave that alone then. Last thing is strength training. We already spoke about it a little bit. You tend to use it, it seems like,
I
when a
too.
runner has an issue. Yeah, I can tell. I mean, pretty jack. Um, no, but when people have a running related injury, you tend to use some strength training. Can we say that it prevents injury?
I would not go so far as to say that it prevents injury. No, unfortunately,
Okay.
the majority of the literature is on performance, and so we can actually pretty confidently say that if somebody is building up to some of these higher loads, so things in the 4 to 5 rep max range, that is the type of strength training that improves running economy and time trial performance.
Hmm.
Um, the specifics of it are pretty across the board. I mean, Rich Blagrove had a systematic review on this, I think, in 2018, and he's published a bit in the space on strength training for runners, and it's kind of more in categories. So there's like your just maximal strength category, your explosive strength, which I am saying in quotations because explosive strength kind of has this connotation of like, well, you're moving a weight quickly, but if you picture the force velocity curve, that could be anywhere along the range of just a little bit less than the heaviest thing possible as fast as possible, or just a little bit more than the lightest thing possible as fast as possible. That gets to
Right.
a whole discussion about power and force velocity and things that you might have actually talked to Chris about. But yeah, you get the like maximal strength explosive and then a true plyometric or reactive strength, and true like fast plyometrics are categorized as less than 250 milliseconds on the ground. So things like your pogo jumps, hurdle jumps, the goal is get off the ground as quick as possible. Pretty much any combination of those three things and somebody will apparently improve their running economy and time trial performance. um, i
Cool.
tend to I tend to gravitate towards the build somebody up gradually to get to slow, heavy things as like my first line. And that is because, well, we don't really have any literature that shows injury prevention, right? But we do have literature that shows, well, we improve muscle architecture with heavy strength training. We improve bone density. We improve tendon stiffness. All of these things that we actually think are pretty good qualities of those tissue. And so if we don't train like idiots, maybe it could help us reduce the risk of some injuries.
Yeah.
That the real like the main issue from a research and methodological standpoint is that the types of strength training programs that are used in some of these injury prevention studies are not the same as the strength training that you see in performance studies. So you
Mm.
see like actual strength training in performance studies, and in the injury prevention research, it's a lot of just like body weight squats, squat jumps, body weight single leg RDLs, like very, I would put in the category of like low load motor control exercises
Yeah.
that maybe have a stimulus if somebody is like so not trained that you could get them stronger by just looking at them. um, and then some jumping and hopping related things, those don't seem to reduce the risk of injury. um, that is, there was a study on like the foot core, and I actually don't even want to get into that one. It was a whole thing. I don't think the foot core is the answer. Don't at me. And um, yeah, so from the methodology standpoint, we actually just haven't tested like a good strength training program.
Mm.
So that study doesn't exist.
Yeah, like maybe if biomechanics were a really, really strong variable, then maybe if there was a carryover from the motor control exercises
Well, that's
into
exactly
running,
it.
that
Yeah.
then maybe that could be something. But for me, it stands to reason that like for bone stress injuries, for example, if low bone density is a risk factor, a good quality, resistance training program that could increase bone density, to me, it stands to reason that it could help decrease the risk a bit.
At least addressing one of those very large number on the wheel modifiers, right? Because
Yeah.
you say like, well, why did they have low bone density in the first place? There's an energy availability thing. There's other things going on, and so that's another important point too. If somebody is in a state of low energy availability, strength training and plyometrics are probably going to harm as opposed to help in that case, because you're continuing to feed into low energy availability. And so the
Right.
bone can't even really adapt in those conditions. You're just adding more deleterious stress,
Yeah.
um, which is
Fair
another
enough.
reason why this is complicated, right? Because you could say, like, well, we did all the stuff that improved this person's bone density actually worsened this person's, and there was nothing else here other than just the presence of energy availability.
Yeah.
Yeah, so I mean, I still use it. I promote it to all of the runners that I see on the clinical side, and I have a lot of just running performance clients who use my resources for performance training and testing as well.
Mm.
As we mentioned, I have a number of cool toys. Yeah, but yeah, I think it's for people who from a performance standpoint want to get better, and then just from a well-rounded health standpoint, like if the only thing you're doing is running, then there are going to be some hard times that you fall on in life, like
Mm.
carrying your laundry basket up and downstairs when you get older, and tying your shoes at some point. So,
Yeah.
um, maybe
Yeah.
maybe to be a well-rounded, healthy human, throwing some strength training into the mix is a pretty good thing for that too.
Right. And speaking of being a well-rounded human and preventing injury and not only doing running, earlier on, you said something that you thought was quite prudent for yourself, which was sports sampling.
I
So
did,
do you
yeah.
want to touch on sort of where you're going to go with that earlier on?
Yeah, so there's some research on bone stress injuries, that sport sampling at a younger age, so playing at least one season of some kind of contact or acceleration invasion based sport, soccer, basketball, gymnastics, American football, improves bone density by the time someone is basically outside of the range of puberty. So like 16 to 18 years old range.
Mm.
After that, it's actually pretty hard to change your bone mineral density in a large way. So the majority of what we're working with were decisions that we made when we were up to the ages of 16 to 18, which is
Perfect.
terrifying.
Yeah, we were all very wise back then.
Yeah. Yeah. 10 years before our brain decided to stop developing is when our body needed to stop developing.
That's
And
brutal.
yeah, it really is. So individuals who only did actually gymnastics was a sport that increased the risk of bone stress injuries. If someone specialized in gymnastics, endurance events, or just one particular sport, were much more likely to go on to develop a bone stress injury than someone who played multiple sports or at least one ball based change of direction sport.
Interesting. Why do you think that is?
There are a couple theories on it. One is the actual multi-directional loading of the bone. So just different vectors that are outside of the sagittal plane.
Yeah.
Um, the bone is really it's really sensitive to loading, in the sense that once it gets to a certain number of loading cycles, like up to 40 or so of the exact same stimulus, it pretty much has a cap on how much it can continue to develop, at least in a certain window of time. So let's say you're running straight forward for 40 loading cycles, but then if you start to cut off to the side and change direction, now you're changing the vector of that bone loading, and you're loading a different part of the bone in a different
Mm,
way from a compression or tension standpoint. The other
I
is just
see.
muscular contraction. So bone is loaded most not from the actual impact of the ground, but from the forces of the muscles pulling on it, which then creates a bending moment. So the soleus and gastroc soleus is the best example of this, where it's contracting behind the tibia and it's creating this bowing bending moment. The hamstrings and quadriceps do the same thing for the femur, create a bending
Hmm.
moment around the femur. So when we sprint, when we cut, when we change directions, all of those activities are higher loaded in peak loads compared to running, and compared to some, things like cycling and lower impact based things. And so some of it is probably just the bending forces on the bone are that much higher when you're doing those cutting, change of direction, deceleration, sprinting movements. Because
Hmm.
sprinters,
Irrespective of the vector sort of involved,
yes,
just
yes,
from like
exactly.
an, I guess, like an impulse standpoint,
Yep,
like the
exactly
force
that.
is higher.
Yeah. Sprinters who are not known for their deceleration, because their sport is just acceleration and top speed and then slow down
Yeah.
as long as you need to or hit a wall, they have a higher bone mineral density compared to distance runners. Now, the other confounder is that their other aspects of their training involve heavy lifting,
Yeah.
jumping,
Yeah.
plyometrics. So it's hard to say, like, well, this one group only sprints and this one group only runs distance. There are also probably other contextual factors, like for sprinters, it's kind of more of a culturally normal thing to be muscular, and for
Yeah.
distance
Yeah.
runners, there's this kind of cultural, like, well, you should be thinner.
Right. You should be
Idea
light.
around it. Exactly. Yeah.
Yeah.
So a lot of confounders in it, but it would stand to reason that sprinting, which has a very, very high load on all of the muscles in the lower limb, it's creating higher bone loading, and that adaptation is positive.
Hmm. Maybe more so if, you know, you're less than 18 years old or so.
Well, right. Yeah, you also still have to be young. So everyone who's listening to this above 18 is just like really punching the air.
Yeah, I think that's everybody.
Yeah.
Sorry, everyone.
Yeah.
I think we can end on that happy note. We didn't quite get to dynamometry, but again,
No,
we did
that's
a lot
okay.
with Chris, and we could save it for another time if you'd like to join me again.
Yeah, see whatever Chris said. I usually agree with him.
All right, cool. Jason, thanks a lot. That was like very, very informative in so many different areas. So I think if people aren't up to date on running related injuries, this will serve as a really, really good resource for them. So thanks. You did an awesome job. Is
Awesome.
there
Yeah. Thanks,
anywhere
man.
where people, yeah, my pleasure. Thanks for joining me. Is there anywhere where people can find you or learn more from you?
Yes, I'm poking around on Instagram at Jason Tuori PT, I think. And then about once a week I post to just basically say the new PT Inquest episode is out. We have a rival PT podcast. Yeah. Yeah, we put out episodes every Tuesday. We Chris, Meg, and myself just chat about a journal article and among other things. Sometimes more the among other things than the journal article, which is fine.
Yeah, especially at the start of the episode.
Especially at the start of the episode.
Yeah.
You got to stay entertained.
I listen to it every week. It's great. So
you're a regular listener, huh?
I am. So again, at risk of hurting my own podcast, guys, go check out PT Inquest. You guys post more consistently right now than I do. So
yeah. And then Chris and I, we teach a course called Dungeons and Dynamometers, which is a fun little weekend course where we do a bit of critical thinking and then kind of the whole biomotor setup and execution of handheld dynamometry and force plates and things like that. So follow us, on social media. We usually post about courses when we have those too.
Awesome. And any resources for people from a running standpoint where they could learn a little more that you could think of?
Yeah, that's a good question. Rich Blagrove was the name of the systematic review author that I mentioned. I really like his book. If you're interested in strength training for runners, he has a book that is called, it might actually just be called Strength Training for Runners. Yeah, if it is, it's one of his two books. The other one is about running performance, which is also quite good. Yeah, I really like that one. Another that is really an easy read is Chris Napier's book. I think that one's called The Science of Running. Really nice distillation of a lot of research down into kind of like practical based things. So I actually feel like that's a really nice book that can span the runners can read this and understand it, and also healthcare practitioners can read it and kind of get into the to kind of get into the science of running a little bit more.
That's awesome.
Those are really nice reads. And then I usually just I look up any podcast that Brian Heiderscheit is on. He actually had a podcast for a while. I don't know if he's still making episodes, called the Mountain Land Running Podcast. Here I go, sponsoring another podcast.
That's two now. You only get one more.
I know. He always gets some really good running researchers on, and they just chat about a paper too. Awesome. So yeah, can't go wrong there.
Cool. Okay. Yeah, I'll check those out as well.
Yeah.
All right, Jason. Thanks again. Really appreciate it. Good chatting. Yeah. Nice to meet you.
Sounds good. Thanks again for having me on, Noah.
My pleasure. And I'll let you know if I'm ever in Rochester.
Yeah, right across the lake.
Yeah. Thank you once again for listening to the podcast. If you enjoyed it, please consider leaving a review. If you would like to follow me on social media, you can follow me at noahmandel.physio on Instagram and TikTok. Have a wonderful day, and remember to keep moving forward.